Hello guys! Before ako magpakilala, may isa muna akong katanungan sa inyo. Anong tawag niyo dito? Huhulaan ko kung anong tawag niyo dito. Hula ko, rotation no? Pwes, nagkakamali kayo. Gusto mong bawas-bawasan yung pagkakamali mo before tumuntong ang 2025? Pwes, nasa tama kang video guys. Nasa tama kayong video. Don't skip or don't scroll kung ayaw nyong malasing kayo sa 2025. I'm Czarina Bernadette F. Aliñabon from BPED 101 and samahan nyo ko to dig in more about movement terminologies. Gliding is the sliding of flat joint surfaces like in wrists, ankles, the articular facets of the vertebrae with slight movement but no rotation. The second one is angular movement. It involves increasing or decreasing the angle between bones, including flexion, extension, hyperextension, abduction, adduction, and circumduction. Flexion, extension, and hyperextension. Flexion decreases the angle between bones. Extension straightens the joint, and hyperextension extends the joint beyond its normal range. Abduction and adduction. Abduction is the movement of a limb away from the body's midline, while adduction is the movement of a limb toward the midline. Circumduction. Circumduction is a circular movement of a limb. The third one is rotational movement. Rotational movement is when a bone turns around its axis, such as turning the head side to side or rotating the limb inward or outward. It also includes specific actions like supination and pronation. Lateral and medial rotation. Lateral rotation is the turning of a bone away from the body's midline, while medial rotation is the turning of a bone toward the body's midline. Supination and pronation. Supination is the rotation of the forearm or foot that turns the palm or sole upward or outward, while pronation is the rotation that turns the palm or sole downward or inward. Brace ourselves for our fourth and last movement because this is a little bit long. Let's welcome special movements. These are the unique motions occurring on specific joints such as inversion, eversion, dorsiflexion, plantar flexion, opposition, preposition, protraction, retraction, elevation, depression, and lastly lateral flexion, allowing specialized actions like shrugging shoulders, turning the foot or thumb finger contact. Inversion and eversion. Inversion is the movement of the foot where the sole turns inward toward the midline of the body. Eversion is the opposite movement where the sole of the foot turns outward away from the body's midline. Dorsiflexion and plantar flexion. Dorsiflexion is the movement of the foot upward toward the shin. Plantar flexion is the movement of the foot downward, pointing the toes. Protraction and retraction. Protraction is the movement of a body part forward, such as pushing the shoulders or jaw outward. Retraction is the opposite movement, pulling a body part backward, like pulling the shoulders or jaw inward. Depression and elevation. Depression is the movement of a body part downward, such as lowering the shoulders. Elevation is the opposite, raising a body part upward, like shrugging the shoulders. Lateral flexion. Lateral flexion is the bending of the spine or neck to the side, away from the midline of the body. And that's it guys, we're all done. I hope this video helps you in many ways. And to those students who are watching this, I know your pain, I know your struggles. Charis. Basta yun. Oo, to those students na nanonood nito, padayon guys, I know na madami pa tayong pagdadaanan and I know na makakaya nating lahat to. Kaya, kapit lang. So, pa yun, advance Merry Christmas and advance Happy New Year. Thank you for watching. Bye-bye!